Hello, I am Dr. Sharada, Director, LBR Dental Implant and Facial Aesthetic Center. Today I am going to talk about snoring. Snoring is nothing but a harsh sound coming from the nose or mouth due to partial obstruction of breathing while sleeping. Nearly 80% of the people, especially men, snore, and it need not be due to an underlying disease. Examples include nasal congestion, anatomic deviation of the nose or the soft palate, alcohol consumption, and it might be due to excessive weight, that is obesity, or lifestyle changes, and also due to stress. And aging also is one of the reasons. But for some people it can be a chronic problem and indicate a sleep disorder called obstructive sleep apnea, which is associated with symptoms like breathing pauses while sleeping, or choking or gasping for breath during nights, early excessive daytime sleepiness, morning headaches, sore throat while awakening, or high blood pressure. Obstructive sleep apnea should not be ignored and such people should seek medical attention. Now I am going to discuss about the home remedies that can control snoring. Treating nasal congestion. Eucalyptus oil steam works great to clear nasal congestion, and lose weight if you are obese. Avoid alcohol close to bedtime. Practice anti-snoring workouts, and you can also try nasal strips. Next, oral appliances like anti-snoring devices work best for this. This is customized, non-invasive, and it not only curbs snoring but also treats symptoms of mild to moderate obstructive sleep apnea. As you can see in the video, this device consists of upper and lower retainers that are attached with connectors and aimed at repositioning the lower jaw forward, thereby allowing airway to remain patent and prevent snoring. I want to conclude by saying that snoring does not mean deep sleep, and if it is associated with other symptoms, then it is an indication that you should see a doctor for further evaluation. If you find this video informative, please like, share and subscribe. Thank you.